Hi, my name is Lady. I'm one of the pharmacy students today, and I'm presenting Lisa Baxter. She's a 47-year-old Hispanic female that came to the emergency department with persistent diarrhea. She stated that she has had 4 to 5 watery stools yesterday and 2 today before coming into the emergency department. She assumes that it was something that she ate, although she denies having diarrhea that has lasted for more than 1 day. When asked about antibiotics, she admits completing a 3-week therapy of clindamycin for a food infection, which she just finished last week. Her past medical history includes a diabetic foot ulcer, which is resolved and that was treated with clindamycin, and type 2 diabetes. She does not smoke or drink alcohol, and she does not have health insurance. The patient has a severe allergy to penicillin, which results in an anaphylactic reaction. And her home medications include Januvia 100 milligrams, 1 tablet daily, lisinopril 20 milligrams, 1 tablet daily, atorvastatin 40 milligrams, 1 tablet daily, acetaminophen 325 milligrams, 1 tablet every 4 to 6 hours is needed for fever or pain, women's multivitamin 1 tablet daily, insulin Lispro 100 units per milliliter pen. She injects 8 units subcutaneously before meals. Insulin Glargine 100 units per ml. She injects 20 units under the skin at bedtime. And finally, clindamycin 300 milligrams, 1 tablet 3 times daily for 21 days. And she completed this course of treatment 1 week ago. She's up to date on all of her immunizations, and her physical examination revealed stomach cramping, positive bowel sounds, and a soft and tender abdomen. Her blood pressure is 140 over 77 millimeters of mercury. Her heart rate is 73 beats per minute. Her temperature is 99.5 Fahrenheit. Her respiratory rate is 14 breaths per minute. She's 64 inches tall and she weighs 177 pounds. Her BMI is 30.4 kilos per meter square, and this is classified as obese. Her labs include white blood cell count of 13,400 cells per milliliter, which is elevated, serum creatinine of 1 milligram per deciliter, creatinine clearance of 71.4 milliliters per minute, and finally, she had a positive result for a C. diff toxin and antigen test. So this patient was diagnosed with Clostridium difficile based on her clinical presentation of greater than 3 watery stools in the last 24 hours without any use of laxatives, and she was also positive for the C. diff toxin and antigen test. We can classify her infection as non-severe, as her white blood cell count is less than 15,000 cells per milliliter, and her serum creatinine is less than 1.5 milligram per deciliter. The most likely cause of this infection is her recent use of clindamycin for 21 days to treat her foot ulcer, and also the fact that the patient has diabetes puts her at increased risk for developing infections. The IDSA guidelines for Clostridium difficile that was updated in 2017 strongly recommends oral vancomycin for a treatment of non-severe initial episode of Clostridium difficile. However, since the patient is uninsured and the capsules run a little bit pricey, I would suggest to prepare an oral solution from a vial of vancomycin powder for injection. This is a much affordable option for the patient, and the pharmacy can compound it for her. The goals to treat this problem will be to eradicate infection and to prevent recurrence of more C. diff infections. My treatment recommendation would be vancomycin 125 milligrams by mouth 4 times daily for 10 days. Some things we want to monitor for as far as safety goes, it would be to monitor for adverse effects, but especially for any signs of anaphylaxis. Improvement monitoring would be developing of solid stools, resolution of symptoms, and a white blood cell count that goes back within normal range. So this is all I have. If you have any questions, please let me know. Thank you.